These tiny but vital devices can hold the artery open in an area where you have a narrowing. They are inserted in an angioplasty procedure, either as an emergency to treat a heart attack, or in a planned way to widen an artery that is being narrowed by a buildup of fatty plaque. If the artery is stretched open with just a balloon, the artery may recoil and narrow again afterwards. The risk of re-narrowing is around 30%, whereas when a stent is used this reduces to around 10 to 15%. If that stent is a drug-eluting stent, the risk is further reduced to around 2 to 3%. Nowadays, stents are used in all angioplasty procedures, unless the blood vessel is too small or too large to put a stent in, or the patient has an allergy to the material in the stent. Stents can treat heart attacks and angina when used in your coronary arteries. They can also be used in the legs and occasionally in the neck or the renal arteries, which supply the kidneys. Stents are cylindrical in shape, and they are made from a very fine metal mesh. The most common stents are around 15 to 20 mm in length, but can vary from 8 to 48 mm, and are 2 to 5 mm in diameter. A long hollow tube is inserted from the wrist or the groin and guided all the way to the narrowed artery. A very fine wire is fed through the catheter and into the narrowing. Over that wire, a balloon is inserted with a squash-down stent on it. Once the cardiologist is happy that it is in the right position, the balloon is inflated, widening the narrowed part of the artery and expanding the stent to fit the artery wall. Then the catheter, balloon and wire are removed, leaving the stent in place. The procedure usually takes 30 to 60 minutes. It is made from metals such as stainless steel, platinum chromium or cobalt chromium. It may also have a coating called a polymer and, in most cases, a coating of a drug to stop scar tissue growing between the gaps in the stent. These are called drug-eluting stents and are used around 95% of the time because the long-term results are much better. It's generally painless. You'll have local anesthetic injected before the catheter is put in. The inside of the artery doesn't have nerve endings, so you shouldn't feel anything there. Some people experience mild chest pain when the balloon is inflated. You'll be awake throughout and lying down. Some patients can have sedation, but most don't need this. It's common to get a little bit of bruising where the tube went in. This usually clears within a couple of weeks. Bleeding is uncommon, but easily resolved by applying pressure to the site. The risk of bleeding is lower in the wrist than in the groin because the artery sits just under the skin, so putting pressure on the site is more effective at stopping the bleeding quickly. The risk of a major complication is less than 1 in 100. This includes splitting the walls of the artery when the balloon is inflated, known as a dissection, which would be treated quickly with further stents.